Hello, everybody. Today we're going to be talking about government healthcare facilities. We're going to talk about what qualifies a service as governmental and what are some example government agencies. Obviously, right now, we won't be leaving our houses for some time, and the government is in charge of that, and with good reason. And here are some resources to help us out and understand more about what's going on. Okay. All right. So we're going to differentiate between government agencies based on their services offered to the general public. So these can be local, state, national, and international levels. Taxes support their services. So health departments, veteran administration hospitals, things like that. Can you think of any other examples? I'll give you a hint. It's international. The UN is a government agency and it actually ties together all agency governments from around the world. Very important agency. All right, so the first one we're going to talk about is the World Health Organization, the WHO. They are not a British band. You might not know who they are, but I know who they were from back in the day. It's actually an international agency. They're sponsored by the United Nations. They do a lot of statistics, healthy living, education, just try to treat serious health problems around the world. April 7th is National Depression Day, and April 25th is Malaria Day, two things that have plagued many countries. And when I was in Africa, which you'll hear a little bit more about later on, I thought that I had malaria. I ate an egg sandwich in Uganda and had lots of symptoms of malaria. Went to the hospital and found out, well, you don't eat egg sandwiches in Africa. I even put mayonnaise on the sandwich. Yep, shame on me. I deserve to get food poisoning. The U.S. Department of Health and Human Services, USDHHS, they are a national agency that deals with health problems in the United States. They offer a lot of services, okay? Top story. What a shocker. COVID-19. It just offers a lot of support, education, and information. So I would definitely, if you're looking to get more information about what's going on right now, I would go to that website and not Facebook. National Institutes of Health, the NIE. It's a division of the USDHHS involved in researches on disease. Some examples in 1990, they mapped the chromosome 7, which is a very important chromosome for the human genome. In 2000, oxygen was found that it could decrease infection after surgery. 2010, they actually discovered cartilage gel that could come from rabbits to help people's cartilage in their joints last longer. I don't think it really helped, but they tried. And in 2020, maybe we can find the cure for, you know it, COVID-19. Let's hope, everybody. Food and Drug Administration, FDA. You have heard of them before. It's a federal agency. That means around the country, responsible for regulating food and drug products sold to the public. What is not regulated by the FDA and should scare you? You should know this. Supplements, your Flintstone gummies, the omega-3 oils, all that stuff is not regulated. So you don't know what you're putting into your body, and you'll watch a video in sports medicine that might scare you about trying to take all these things to get gains, lose weight, take my vitamins. Sometimes it can be unhealthy and overly toxic doses in them. Recent recalls, just so if you eat any of these foods, this was last year, this is the stuff that was found in them and why they were recalled. Market Side Spring Mix, which is a salad, they had pieces of bat in it. Hunt's Chili Kit had salmonella. So did Chipotle back in the day. Nutivia products had undeclared peanuts, so if you're allergic to peanuts and you ate it, that would be bad. And here's the kicker, Trader Joe's applesauce had pieces of glass. I like texture, I like crunch, but I don't like to cut my gums. Centers for Disease Control and Prevention, our best friend. We took a field trip there. We have learned a lot from them. The CDC is a division of the USDHHS. They're obviously concerned with the cause, spread, and control of disease and other health and safety issues in populations. So obviously, they're very important what's going on right now. I always say, does it worry you or make you feel comfortable that it's in Atlanta? You know, They might have been at the center of the Ebola crisis a couple years ago. They're obviously involved in the crisis that's going on right now. Me personally, I'm glad they're right here because I feel like we get the best information from them as quick as possible, and their protocols are enforced quickly to help us eliminate any potential worsening of a system or a situation. So I'm happy they're here. When we go to the CDC, we always ask, where is the bad stuff? They always say it's on level 5 underground. But if they were ever to bomb or a terrorist attack ever to hit CDC, there's no way that that stuff would get into the air. It would be evaporated. There's protocols in place, so you don't have to really worry. I always mention bat bacon here because they let us know that it is uncommon to get rabies from eating animals as than an animal that had it. I've heard that bats taste like bacon if you roast them over a crispy fire. But just in the last slide, the FDA, if you found a piece of bat in your food, you can't get rabies from it. You can probably get a lot of other stuff from it, though, anyway. Agency for Healthcare Policy and Research. They are AHRQ now, and they do a lot of standards on healthcare facilities, okay? And how do you think they get the results? Well, probably the most annoying thing possible, but it is the best way to compile data. This is why I had you do one too. Surveys, lots of them. That's why every time you're at school, when we were at school, and they ask you to do a survey, the data is very important for us to try to shape education and help people out as best we can. So next time you take a survey, just try to take it seriously. It's not that long. I know it's annoying, but they really do help. With the information they gather, they actually can find out how our healthcare quality ranks between states. Well, around 2015, you can see where Georgia ranked bottom 10 in the United States. Since 2018, we're looking a little bit better. So now we are in the middle 31, which honestly, that means we could be 31 or 30 and we still hit that category. At least we're not in the bottom 10. And who knows after this pandemic goes away, where we'll stand now. Occupational Safety and Health Administration, your best friend OSHA, you know of this. It was one of your medical terms. They establish them for standards that protect workers from job-related injuries and illnesses. April is actually Prevent Workplace Violence Day. So this is between staff members, between patients maybe, anywhere in between, strangers that just show up. So what facilities are most at risk in the healthcare scene? The emergency room. You've ever watched Untold Stories of the ER? You could probably see some characters in there. I know one time I went to the ER with my friend who dislocated and fractured his ankle, and the guy that was sitting next to us got in a fight from a NASCAR race watch party, had a broken nose and some busted teeth, and he was even fighting his own mom who was in the emergency room with him, trying to help take care of him. So many times there's usually substances involved in these scenarios. And yeah, just got to take the necessary precautions to avoid workplace violence. Public health system. These are just health departments that are part of the USDHHS. They provide services to state and local communities. Some examples are immunizations, environmental health and sanitation, collection of health statistics and records, more education, and try to do some prevention. So what is their main focus right now? I'm pretty sure you can guess. Yep, COVID-19. It's very important that anyone that has any questions about it, you go to this website or other websites. They're giving out great resources, okay? Veterans Administration. So this is where veterans can go to get care that served in armed forces. You know, these are backed by government funding and taxes, but word on the street for many years is that these facilities aren't the best equipped. They don't care for our veterans like they should. And it's probably just because the amount of money funding they're getting isn't as much, and there isn't a big focus on veterans right now. And so we definitely need to change that. It's been something that needs to be changed for many, many years, and you'll hear many politicians talk about it, and it definitely needs to be addressed. So my experience is working for government organizations. I spent a whole summer in Africa. I've been taking many trips to Africa and Uganda. My father worked there. I work for the U.S. Agency for International Development, USAID, AID. I worked in the Water and Sanitation Department. I read reports from non-government organizations, NGOs, that were going to take government funding to help a third world country. You can see in the picture on the right, that is one of the towns I visited. It was in a area called Gulu, where they were on a ceasefire from Darfur, southern Sudan, and northern Ugandan war. So some of the NGOs I worked with was CARE, Catholic Relief Services, and the United States would give them money, and they'd have to write a report what they would use it for. And then I was the guy who literally went out there to see if they did their work. Some places didn't have their work done, and I had to ask them what is their timeline to get it done. I would GPS track every thing that they said they're going to finish, and a lot of them were boreholes, which are water pumps. You can see in the pictures people with yellow cans. Those are water, so they would have to walk to the closest water pump that was either manual, electric, or solar, and pump their water and then carry it home. And those women in the pictures would actually put these tanks of water on their head. So I would read all those reports, go out in an armored vehicle to these camps, and I would try to track them down. And all the little kids would follow me and scream out, Muzungu, Muzungu, which means white person, because many of them had never seen a white person before. So I would just have a pack of kids follow me everywhere I went. There's a picture of me with no beard, so if anyone ever wondered what I look like without facial hair, there you go. I made a lot of money doing it. It was very eye-opening because third world countries, like people live like that. And, I know we're all living at home right now, but we still have a lot of things and access to things that other people in other countries don't. Like shoes. Half the people in that town right there, I'd say maybe 90% don't even have shoes. Kids are playing with soccer balls that is a rock wrapped in banana leaves and plastic bags. So even though we're at home and this is trying time, remember we still have a lot of good things in front of us and we just need to appreciate them. So please use the info from these websites. If you have any questions about the pandemic that's going on right now, I'm not going to teach you about the pandemic myself, but I want to give you at least resources instead of fake resources like Facebook, Instagram, your best friend. These are more reliable sources for you to search for any answers that you might be searching for. Of course, be safe, social distance, pick a hobby, work out from home, maybe go outside for a walk in your neighborhood for the 18th time. Make a routine. I know that making routine for me has definitely got my head on straight. And we're just going to keep counting down the days until we can all see each other again. All right. Y'all have a good one. Peace.